Welcome to the legislative update for the week ending Friday, March 26th. My name is Colleen Patterson, and I'm the Director of Employer Services and Compliance at Savoy. So let's get started for this week. A bill to move the Paycheck Protection Program, or PPP, application deadline for March 31st to May 31st won approval in the U.S. Senate on Thursday. The legislation had previously passed the House earlier this month. As a result, the legislation is being sent to the president for his signature. The bill is called the PPP Extension Act of 2021. Next, the Biden administration recently released another round of FAQs regarding health coverage provisions in the FFCRA and CARES Act. The guidance sheds light on group health plans coverage requirements for services related to COVID-19. The FAQs address diagnostic testing, explaining the requirements for health plans to cover certain COVID-19 testing and diagnosis items and services. Specifically, there may be no prior authorization, cost sharing, or other medical management requirements applied when it comes to these tests and services. The requirement to cover COVID-19 testing at the first dollar level includes when an individual is asymptomatic with no known or suspected exposure to COVID-19. All health plans, except retiree only, must cover the test without cost sharing, prior authorization, or other medical management requirements unless the request for a COVID-19 test is for general workplace health and safety or for public health surveillance. Also included is information regarding vaccinations and preventative services. Group health plan sponsors need to be aware of the effective date of coverage with all COVID-19 vaccinations as they are approved and made available to the public. As of today, we know that we have the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. The first dollar vaccination coverage requirement applies regardless of how the administration is billed and regardless of whether a COVID-19 vaccine or any other immunization requires the administration of multiple doses in order for it to be complete. A plan or issuer also may not deny coverage of recommended COVID-19 vaccines because a participant, beneficiary, or enrollee is not in a category recommended for early vaccination. So moving on, for more information on the Families First Coronavirus Response Act, or as we know, the FFCRA, I just want to go over a couple things because there was some additional changes as a result of Arpa. So just as a reminder, as we recall, the FFCRA required employers with less than 500 employees to provide certain forms of paid COVID-related leave to eligible employees. So at an extreme high level, the FFCRA had provided emergency paid sick leave, which was known as EPSL, and emergency family and medical leave, which was known as EFMLA. The FFCRA's mandatory leave requirements, they sunset on December 31st, 2020. However, also in December of 2020, Congress passed a stimulus package which included that employers could voluntarily allow employees to use the remainder of their allotted EPSL or EFMLA for qualifying reasons all the way through March 31st, 2021. If the employer allowed the continued use of this leave, the employer would be entitled to the same tax credit as provided under the original FFCRA law. But here's the thing to remember though, this assumes that the employer ensures that they are carrying out the leave exactly how the law was originally written under FFCRA. That's the only way they would be entitled to those continued tax credits. Now enter in Arpa, and as we know, Arpa is the American Rescue Plan Act. Arpa expands the scope of both the EPSL and EFMLA to allow employers to voluntarily provide additional leave from April 1st, 2021 through September 30th, 2021. The new FFCRA leave under the Arpa is not mandatory, so it continues to remain optional, but if an employer chooses to do so, they are entitled then to the same tax credit, assuming that they are carrying out the leave as written under the FFCRA. Highlights of the Arpa expansion includes a new FFCRA timeframe, new EPSL and EFMLA bank of time, expanded reasons for EPSL leave, expanded reasons and paid time under EFMLA. So there's a lot here under ARPA. So if you want to have specifics on all of these pieces that we're talking about, you definitely can go to our website and learn more. The new rules also address non-discrimination. The ARPA mandates that employers are not able to claim the tax credit if there is any discrimination in favor of highly compensated employees, full-time employees, or those with longer tenure with the employer. And just a reminder, the highly compensated employees is defined by Section 414Q of the Internal Revenue Code. It appears that the non-discrimination test applies separately to EPSL and EFMLA. So an example would be somebody could be disqualified from taking the tax credit for EFMLA leave due to being provided in a discriminatory manner. However, they may not disqualify the employer from taking the tax credit for EPSL as long as it was provided in a non-discriminatory manner. So definitely make sure that if an employers are taking advantage of the tax credit because they're offering this voluntary leave, that they are very mindful of non-discrimination rules. Moving on to the federal COVID-19 marketplace special enrollment period, there was a lot of changes about this under ARPA as well. On January 28, 2021, CMS announced the reopening of the open enrollment period for the federal marketplace for the period of February 15th through May 15th, 2021. Just as a reminder, open enrollment is generally November 1st to December 15th, and those enrollments would be effective for a January 1 date. However, on March 23rd, CMS issued guidance extending the open enrollment for the federal marketplace through August 15th, 2021 to newly enroll or change to a new plan based on their eligibility for increased financial assistance to help pay for marketplace coverage. Remember, changing a plan resets the deductible and the MOOP to zero. Coverage is prospective and begins the first of the month after plan selection. Current enrollees should submit an application using the Report a Life Change path to update their application on or after April 1st to receive an updated eligibility determination. Members will have 30 days after they submit their application to select a plan. This SEP will not involve any new application questions or require them to provide any additional documentation of a qualifying event. So an example of a qualifying event would be loss of a job, birth of a child, etc. And those things are usually required for an SEP eligibility. However, this time period, though, is a true open enrollment. We're going to be releasing some more information on the marketplace subsidies because there is a lot to cover in ARPA as it relates to that. So this concludes our update for this week. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use the resources available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.